5-year-old Jada's sore throat wasn't getting better. We explore the dangers of untreated strep throat, plus the warning signs her family almost missed that had her airway in danger of closing completely. Good morning, I'm Alexis Del Cid in for Jessica Lovell. We apologize for the slight delay. We're coming on to you about 4 minutes later than we typically do, straight up at 8 a.m. because we had a power outage in the studio, which has not happened before, but we were able to get back on, and here we are. Thank you for sticking with us, and welcome to the Morning Medical Update. We need to talk about strep throat because it affects about 5 million Americans every year. The CDC reports emergency department visits for regular strep infections are now at a 5-year high. You can see here the amount of children treated for strep when we show you this document by age from 2017 to 2023. The highest group, though, ages 4 to 9. Which brings us to today's special guest, Jada. Jada is 5 years old. Her parents had no idea her airway was in danger of closing completely to untreated strep throat. Jada's mom, Quinique, is joining us in studio today, along with Jada, and we have her big brother, Q, here too. So we have Quinique, we have little Jada sitting on the side, if we can get a beautiful shot of her. Jada, hi. Good to have you here. She just started kindergarten. Q, big brother by her side. Thank you for taking the time to be here. Quite a morning.
Of course.
We also have critical care physician Dr. Sean Sood in the studio. He's right next to me. He specializes in pediatrics, along with Dr. Carrie Francis. Dr. Francis didn't treat Jada, but she knows quite a bit about this topic. She's a pediatric otolaryngologist, so she can talk tonsils. We'll say that. You can talk tonsil, and we're going to talk about that today. Quinique, I want to get to you right out of the gate. You have 4 children.
Yes, ma'am.
All were born here at the health system.
Yes, including myself.
That by design. We talked about this. It's a family. It's a family affair.
Yes.
Here at the health system. And having all those little kids, you're used to people getting sick, and it seems like every day when you have little ones, they get a cold.
Most
right?
definitely.
So, Jada, when you got that really bad sore throat, what did it feel like to you?
It was hurting.
It was hurting. Did it hurt even to swallow or eat? Yeah, and that's rough. And could you drink anything without being in pain? No. And Quinique, most parents expect their kids to have a sore throat, as we were talking about, and you expect to go to the doctor and then leave with an answer, and you leave with your child.
Most definitely.
That didn't happen. What did they find?
So I scheduled a same-day appointment and was able to get into her doctor's appointment in pediatrics. And when we got to pediatrics, she came in, and Jada was in and out of sleep because she hadn't been sleeping a lot, to where when she came in, when the nurse came in, she automatically said she wanted to get a second opinion.
Wow.
So then it was kind of like, whoa.
Yeah.
So where when they went and called for the second opinion, they had informed me that her tonsils, as we were sitting there, they were just getting more and more enlarged, to where it was just like, whoa. Did we wait? What happened? I thought she was gonna come in here, get some nose suction,
right,
or leave with some medicine, because she does have bad allergies. So we just thought it was just an allergy thing, because the throat pain didn't come to like the day before, which was on my birthday actually. So, but she was still able to be up and playing. So when we got here, and it turned into a rapid response thing, it was kind of like, whoa.
Really alarming, because
Yes,
you did what so many parents do. I remember doing that. When you have a little kid, they're sick all the time, and if you're going to the doctor every time they're sick, you're never doing anything but going to the doctor.
Just living here.
And after a while, you realize, oh, I can wait this out, and it'll probably be able to be treated at home, where it'll just run its course. But Dr. Sood, that wasn't the case. Jada was diagnosed with strep C and had an abscess on both sides of her tongue. So what does that mean when there's an abscess on both sides?
Yeah, so a typical strep infection doesn't cause an abscess. She developed a complication, and unfortunately she had 2 abscesses, so bilateral, very, very rare case. And so Jada had a complication of her strep throat and had bilateral abscesses, which affected her airway.
So was the abscess on each tonsil?
It was.
And for people who aren't familiar with the word abscess, sounds gnarly. What's an abscess?
It's a spreading of an infection, and
Okay.
so her tonsils were infected, and the antibiotics didn't squash it, and the infection grew, and on both sides, and abscesses, and so it really occludes her airway and makes it difficult for air to come into her lungs and for her to breathe.
So for warning, as far as the warning signs go, you know, back to school means lots of germs. Does this typically pose a risk to patients who have strep? This is pretty
Yeah.
rare.
Yeah, typically strep is not a life-threatening infection, but complications of strep, like peritonsillar abscess, and for Jada's case, having 2 of them can be life-threatening. And you know, big signs and symptoms especially for pediatric patients, I want to reiterate, is drooling. So if all of a sudden your child has a sore throat but is drooling, that's a red flag. And if they can't open their mouth, that's an issue as well. And so
I saw Jada giggling when we were talking about drooling. Were you drooling? No.
Just a little.
Just a little. But I just want to go back to this. What were the signs? Because I would not have caught those signs either.
Yeah.
With that Quinique, was there anything looking back, you're like, oh, that was a little different?
Let me tell you, I have looked back and thought this situation through so many times. Honestly, it really wasn't. I mean, I really thought it was her allergies, and to where she's a playful person. So
Yeah.
the day before we actually brought her in was my birthday. So with visitors coming over, her cousins coming over, she was still active to where coming into the doctor's appointment and hearing if I could have waited any longer, her throat would have closed up. So it's just like, you never know, especially if you haven't had the medical background.
Sure.
You never know what it can. But I think I've called like 3 times on Jada's allergies since then,
Yeah.
to where it's not like, like you said, I have 4 children, to where the warning signs, they can come, but you might not see them. In this case, I think it got worse the longer we were up here. So when we got up here, I took the signs that we could and got it to before it got too far. I think we were
Right.
here maybe 3 to 4 hours before she went into major surgery.
Wow. And you can't beat yourself up about that. I know your eyes well up when we talk about this, but you did what most parents do. You have 4 kids and you're waiting to see how bad it gets and if they get better on their own, or else you'd be living here. When it comes to the surgery, let's get there. Why was surgery the preferred method? And Dr. Francis, we're going to get to you because I want your expertise. Why surgery?
Really to protect her airway, to make sure she can get air to her lungs. Her,
And
her
she need-
tonsils were so inflamed, the abscesses were so big that it was blocking her airway. So you need surgery just to protect the integrity and the patency of her airway.
And we have an image of a syringe. So this is something that Quinique shared with us, so we can give you a true idea of just how much was pulled from Jada's tonsils. Quinique, how many syringes were filled?
So I took this picture and it just gives me chills. The syringe, I was giving an example because that's one thing I could thank the team, the whole KU staff for. When I was up there was never unanswered question. There was never anything shown to me where I couldn't understand they related it to me. So I held this syringe the whole time I was there. That syringe is 10 cc's. It holds 10 cc's in it, to where on Jada's right throat, I think she had 15 cc's of pus. So that was 1.5 of those just on one side.
Wow.
Her left side had 20 cc's of pus. So it would have been 2 of those syringes. And that's just on each side. So total, they took out 35 cc's of pus out of my baby's tonsils.
Oh my gosh, and Jada's so small. There's not a lot of space for any of that in there. Dr. Francis, where exactly do peritonsillar abscesses occur? I want to give our viewers a better idea, and you also shared some really great scans that can help us give a visual as to why she was having trouble breathing.
Absolutely. So I think most of us have seen sort of our tonsils when we look in our mouth, brushing our teeth or anything else. And where these abscesses form is on the medial or inside surface of the tonsil. So not what you see when you open your mouth, but on the other side. And that sits in between the tonsil. The abscess sits in between the tonsil as well as one of the throat muscles. And when that happens, it actually pushes the tonsil towards the center of the mouth. And when that happens, as we can imagine, those tonsils can come together, and as Dr. Sood mentioned, that puts a patient, anyone, at risk for having difficulty breathing. And having it on both sides makes it even more complicated and even more uncommon. Peritonsillar abscesses aren't rare by themselves. They often happen on one side, but we rarely see them happen on both sides. And when that occurs, there's so much blockage. And in someone so small, pediatric patients in particular, with so much infection in the abscess, it can make it really difficult.
Man, we have some of the scans we were talking about side by side. What does the scan on the left show versus the right?
So what we can see in the difference between the two scans, in general, when we're looking at x-rays, CT scans, images, when we see black spaces, those indicate air. So that we want to see air when it comes to the airway or the back of the throat. And when we have significant infections, we don't see those black spaces sort of towards the bottom of the image there. So that means that there's not a lot of space for air to pass through. So when it comes to breathing, when it comes to our ability to lay flat, that can be hard. That can be life-threatening for some patients.
Can we look at those scans again? Because I just want to ask a follow-up question to that. We were talking about the black space in the scans. What angle is this that we're looking at?
Great. So we call this an axial view, but essentially what I would offer is that if we took a cut or a slice sort of horizontally through the face, so from the front of the face to the back of the face. So at the top of the image, you can see the nose.
That's her nostrils.
Yes,
like kind of
correct. At the
looking
nostrils,
up,
and towards the back of the image, it's the back of the neck, the spine.
And where we see the black, okay, on the left-hand image where that black space is that what we want, more of that black space? Because I thought the left was the bad image.
We want more of the
More of
black
that,
space.
okay.
Both of those indicate a lot of obstruction and blockage.
Got it, okay.
We want more of the black space.
Because there was nothing in
Correct.
the other image. And this is an image that shows Jada's throat. What are we seeing when we look at the side view? What stands out to you in this?
Similarly, on the right image, there's a column, a black column, and so that's a column of air where we want to breathe, where we're able to breathe better. And on the on the left image, that column of air is blocked. We see a little bit of black sort of at the top underneath at the top of the image, and we see a little bit of air a little bit further down on that left image. And those are areas of patency. Those are areas where there isn't blockage, but we need that to look more like the right image.
Dr. Sood, I want to ask you this. You see sick kids every single day.
Yeah.
I don't even know how you do it as a parent because you go from sick kids to sick kids. That's quick. You get no breaks. No breaks with little kids at home. Is it common that a strep infection leads to a surgery?
No, and so I really do want to reiterate that strep infections are, for the majority of the time, not life-threatening.
Right.
We had a very rare case where Jada had a strep infection, developed not only one abscess, but two. That's rare in itself. Less than 3% of the time will you get bilateral abscesses. But she's so small, she's
And
so cute.
She's playing rock,
Yeah,
paper,
she
scissors
is.
over
It's
there
so
with her
sweet
big
to see her
brother.
here. And unfortunately, those abscesses were so large, just like Mom said, 15 cc's on one side, 20 cc's on the other. And you can imagine in her age, that's just going to obstruct her airway. And like Dr. Francis is saying, the patency of your airway is lost. You can't get air in, and that's why it became an emergency. And so strep infection does not lead to airway emergencies unless you have not only one complication, but many severe complications. But I'm smiling today because it's so good to see Jada.
Yeah. It's kind of strange because we're smiling and giggling, talking about something so serious, because we see Jada out of the corner of our eyes just actually whooping her brother in rock, paper, scissors. You're very good. What are the surgical options, Dr. Francis?
Sure. So, as Dr. Sood said, there are different severities of an abscess, a peritonsillar abscess like Jada had. So in certain cases, more uncomplicated cases of infection, there are times where we can, at the bedside, use a needle to drain an infection or abscess. That's not as easy in patients Jada's age, younger patients, but it is an option sometimes for older patients with more uncomplicated infections. In more severe cases like Jada, as we mentioned, the operating room is the optimal place to have these surgeries at times because it allows for us to, while a patient is asleep, really get and access the entirety of the infection and drain it effectively. I believe Jada's abscesses or infections were almost 3 centimeters big, which goes to show how much of the pus was drained from her abscesses in the operating room. And that is something you don't want to miss at the bedside by doing a bedside procedure. You really want to do the most effective procedure in this case for her complications. Bilateral abscesses, very large abscesses. The answer was to do this surgery in the operating room.
And it was successful. So every time I see your eyes well up, I want you to take a peek at your daughter sitting next to you, because she's fine.
Oh, yes.
How long was she in the hospital, though?
4 days total. To where Jada was the life of the party. I mean, everybody knew who Jada was.
Yeah.
To where, because, I mean, KU is a student hospital, and it goes to show to where they're teaching not only the students coming up, but they also teach us. Like, I thought so many times that I was told it was a rare case just because of how bad my nerves was. But the situation, honestly, like, nurses would come through and they'd be like, that's her. She ended up staying on the ventilator overnight, but I was explained why. So they got to see her buff side. She was trying to rip tubes and everything. She was a mess when she did finally able to wake, when she got up, she able to take her laps. When she walked by, everybody spoke to her because everybody had kind of knew her situation.
Sure.
And then she finally got up ready to eat, and she wanted seafood and crab legs and everything else she couldn't get here.
And we're going to get to that picture in a minute, because that was the first place Jada went. And what you said, Quinique, about being a teaching hospital, the University of Kansas Health System, yes, it's a phenomenal place for medical school students and for our healthcare providers and patients, but what's great is doctors do such a good job of teaching us and explaining it in plain speak, what's happening in the most stressful times. We love when our viewers ask us questions for the doctors or for our special guests. So you can use the chat right now on YouTube or Facebook, or you can email the Medical News Network. All the information is right there on your screen. And Quinique, when you got the news that your daughter needed to be intubated, were you stunned?
I felt like a bad mother.
Yeah.
Just because how fast everything went. We went to her doctor's appointment, and then we went from rapid response coming up there to ER. Then when we got to ER, we had to get tests. But the call about her going to go ahead and go to surgery, I had a situation with Quintavion being sedated when he was a baby as well. And it just hits way different knowing that they have to be on a machine for him. When he went down, he was down for 2 weeks. So always in my head, I always have a thought like, if they go, I don't know how long they can wake up. I can't wake them up. It's it's up to the machine, the doctors, and everything like that. But my guy held me down for the whole night. I mean, they really made it comfortable. So it didn't matter about the bad news that we were getting. We were able to be comforted and explained what was going on, why it was going on. So it took an ease. I lived up here, so it was okay for me to be here to stay. I mean, to see the doctors stay, to make sure they continue to be with their patients when situations are going on like that. I don't think he left till like the next day, and he would come in and check on Jada. I've seen him since I worked up here. I see him in the hallway, and I'm like, I don't know if you know who I am, but I know who you are. And that's exactly what he told me, like you do. So the call's not the worst thing. Seeing them like that gets worse, but when they're better and they look like this, it's just the best feeling.
You mentioned you work here.
Yes, I work in dietary downstairs.
Okay, so you're definitely a frequent flyer.
Oh,
You're
yes.
here all the time.
KU saved me as well, so I give my support to KU full force.
Your whole family. Dr. Sood and Dr. Francis, and I'll start with you, Dr. Sood, that must really gut you when you hear a parent say they felt like they were a bad mother. Do you hear that often from people? And it's not true. You're a great mom, but
he told me.
parents often blame themselves. What would you say to Quinique?
Yeah, take zero blame, zero responsibility. This progressed so rapidly. There's no fault of yours. You know that.
Yes.
I've told you multiple times, and I understand where the guilt comes from, but the main thing is she's doing so well. You did everything. You got her, you sought care for her in a timely manner, and she's doing so well. And so it's tough because parents do take a lot of ownership, but this is a rapid progression. Her airway got compromised very, very quickly, and I'm just fortunate that she's doing so well today.
Dr. Francis, do you want to respond to that as well?
Absolutely. You know, I think one of the most important things is trusting your gut, and that's the best decision a parent can make. Knowing when something's not right and knowing when it's time to come in to see us. And that happens at different points along the way, but always the right decision.
Yes, ma'am.
You're a good mom.
Thank you.
There are people who want to reach through their speakers right now and give you a hug through their television. I want to get to some of our community questions because we are getting some great ones. Jill has a question. Jill wants to know, Quinique, did any of your other children ever get strep and get sick? If they did, that must have been terrifying after Jada. What a great mom, she says. So Jill says you're a great mom.
Thank you, Miss Jill. Actually, no. None of my kids have actually. I think Quentin has had strep before, but the boys fought through it so tough to where still I didn't know it was strep before we went to the hospital. I'm still thinking it was her allergies. So with kids with allergies, the way that they sleep, the way that they breathe, we went to ENT before because she snores. So she has it. We went to ENT afterwards. Oh, FYI, Jada still has her tonsils. So she was able to keep her tonsils to where she still gets monitored by ENT. But no, I've never had this case. That's what caught me off guard. Strep was go to the doctor, you know, because I'll call pediatrics quick, baby.
Right.
When I feel like I can't handle it. But when it came to strep, even when I was told it was strep, I was like, whoa, really?
Right.
That it could go this far. But like he said, it wasn't just the strep. It was the side effects that she had going on with her at the same time.
I have a question, doctors. Is it common to leave the tonsils in after a procedure like this, Dr. Francis?
It is. No, I'm just playing.
It better be.
Depending on the child.
Depending, actually, yes, depending on the child. So we talked about different surgical procedures a little bit earlier, and there is an option to do a tonsillectomy or remove the tonsils at the time of treating the infection, but it's not always the first treatment or first option available. So many people do keep their tonsils after experiencing a peritonsillar abscess or an infection similar to Jada's. Sometimes the tonsils, as they have gotten enlarged from the infection, they remain enlarged. There are people that will have recurrent or a different peritonsillar infection or more snoring or more episodes of strep throat. That does not happen for the majority of patients. So it is actually fairly common that people will keep their tonsils after one of these infections.
Because they said before that she had larger tonsils anyways for her size. But they said as she grows up, you know, they'll grow to size for her. But we go every 6 months now. Don't worry about it.
In this case, the key was she had 2 abscesses right on both sides to drain the pus out and to make sure her airway was patent was the key in her case. And so once the abscesses were drained, we knew she could take the ventilator, that breathing tube out again, and we had patency of her airway. That was the key in her case.
And patency
Yes.
means clear airway.
Yeah, with integrity,
Yeah.
absolutely.
Your airway has integrity.
Yes, it does.
Jada. It's great. Ruth Guff has a question. She wants to know, do all strep infections require antibiotics? Dr. Francis?
Yes, strep infections require antibiotics. It's a bacterial infection. It's something that can progress, can get worse without treatment, and so strep infections need to be treated.
Do you see a spike in strep infections coming in during the beginning of a school year?
School just started.
They're just sitting in a petri dish all day. Those poor teachers, I
Need
don't
to be
know.
wrapped up at this point. I forgot all about this.
We have seen an uptick.
I have another message from Ruth. You are not a bad mother. It is the toughest job, and you have beautiful children.
Yes, you do.
Thank you, Miss
You
Ruth.
sure do. You sure do. Let's see, we've got one more question from, Becca asked about removing the tonsils, so I think we're good on questions. We just have people saying what a great mom you are. And you truly
Thank
are.
you,
We can
guys.
see
I
it in
really
your eyes.
appreciate it.
I want to get today's takeaways for our viewers. And Quinique, I want to start with you. What would be your message to viewers who are watching right now about your journey and about the care that you got?
Again, I say thank you. Thank you, thank you, thank you. Don't panic. Your kids look at you for the sanity. They look for you for the chill vibes. So one thing I can say is, like you say, just be patient. If you feel like something's wrong, go to the doctor. I say keep checkups. I say make sure my kids come every year to the doctor, dentist, everything. Stay up to date with your kids. Know about your kids. Learn about them so when something does happen, you honestly can do your best then, because everything really is out of your control when it gets so far. But I would take them to KU, just saying. But I would just watch your children. They'll tell you. They know when they're in pain. They know when they're hurting. Even with the other signs that come and go, you just have to stay persistent. Just keep an eye on them. Sometimes these kids want to grow up so fast. My 15-year-old, don't get it twisted, will still come cuddle up with me. To where
He's giving you the side eye. That's sweet.
to where
That's sweet.
it's important to have a relationship with your kids when they're good or when they're sick. So importantly, when they're sick, you got to be the stronger one. That's why I refuse to cry, because Jada, she fought the fight. Like, she was up here, she did it. She went through the worst case. So at the end of the day, even now, that's why I brought her in here. Sometimes doctors don't get to see what they did, how they helped someone, how they fixed somebody. To where in this case, he did. I mean, she's great. To where, I'm so grateful. So I just say, watch them. If you feel like there's something you can't do, call your doctor. That's what they do.
The bond between Jada and her siblings is beautiful. I've seen them cuddling and giggling over there. And Quinique, you also shared a picture with us of your whole family. And I believe it's one of the first things you did after Jada got out of the hospital. You went and got seafood?
Yes. So.
Oh, that's not your whole family. Your family's huge, but tell us who's in this picture.
So that is my leading guy right there. That is my daddy in the middle. And me and my dad's birthday are 4 days apart. So I'm on the 11th and my dad is on the 15th. And Jada came in on the 12th. So
nice.
Since I was a little baby, we've always gone out to eat for our birthdays. So Jada was in here, and one thing we had to do was get her to eat before we could go. They wanted to see how she could process food and swallow and stuff like that. She was drinking more, so it was easier for us to be able to go, especially because I was telling her that she wanted seafood. She wanted crab legs. So that picture, we were at Red Lobster the next day after, but the night of, she was getting her seafood.
Okay.
So the next
She knew
couple
what she
days.
wanted.
Oh yeah, she did. She told
knew
all
what
the
she wanted.
nurses. She's like, you guys
She'll
don't
tell
have
you.
it. I told them, I was like, you guys, I know you guys really want her to eat, but you guys don't have what she wants.
She needs her crab legs. Dr. Francis.
That's your favorite, huh?
Yeah.
Well, I am appreciative of being able to share in your and Jada's story in this way. I would reiterate what I said before. Our job as healthcare professionals, as physicians and surgeons, is to trust you and to take care of you when you arrive, when you come to see us. So my takeaway would be trust your gut. When it's time to come in, it's time to come in. You know best. Parents know best.
Dr. Sood.
Yeah, kids will have sore throats, and strep infection is not a life-threatening infection. But if things do progress and you do get complications, things to look out for as a parent would be drooling, inability to open your mouth, and really a big high spike in a fever. And so you start antibiotics, you're treating your strep, but things aren't quelling. And all of a sudden you get a high fever, or you're drooling, or can't open your mouth. Seek additional care.
Immediate care. It must feel good to see your little patient back and see her mom again under happy circumstances. Jada, how are you liking kindergarten?
Good.
Yeah. And are you a Chiefs fan? Yeah.
Well, she went to her first Chiefs game yesterday.
You did? How was it?
Good.
2 thumbs up? Go Chiefs. Thank you to our guests, and thank you so much to our viewers for being with us today. We really appreciate Quinique taking the time to bring her whole family in here. Thank you, and thank you to our doctors. Have a great weekend. We will see you right back here on Monday morning.
Coming up Monday on the Morning Medical Update. 15-year-old Cohen Gunn faced not 1, but 2 sports injuries that threatened to sideline his baseball dreams. I'm Jessica Lovell on the next Morning Medical Update. The surgery and therapy that got Cohen back to the game, plus the extra benefit of having your therapist moonlight as your pitching coach. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.